Chances are you have this in your medicine cabinet right now. Paracetamol. Or maybe you call it acetaminophen. It's pretty much the world's go-to painkiller. But here's the thought. What if the very thing that makes it so safe is also what makes it so easy to get wrong? Let's break down the hidden rules you really need to know.
I mean, this question really gets right to the heart of it, doesn't it? We trust this medicine so much, but that trust can, well, it can lead to some simple but pretty dangerous mistakes. So, we're about to walk through the critical safety rules that are just too often overlooked, and I bet some of them are gonna surprise you.
Okay, first up, let's just establish how common this stuff is. I mean, from a nagging headache to a kid's fever, it is the first thing millions, probably billions, of us reach for. And you know what? It's for a really good reason.
So what's its job? At its core, it's actually super simple. It relieves pain and it reduces fever. It's not a heavy-duty anti-inflammatory like, say, ibuprofen, but for a headache, a muscle ache, or just bringing a temperature down, yeah, it works incredibly well.
All right, section 2, one drug, many names. And this right here is where the first big risk pops up. It's a simple confusion that leads to so many accidental overdoses, and it all comes down to what's written on the box.
So here it is. Maybe the most critical thing to remember. Paracetamol and acetaminophen are not similar drugs. They are the exact same drug. Seriously, one name is common in places like the UK and much of the world, the other is what you'll see in the US, but the stuff inside, identical.
Just think about all the brands you know. Tylenol, Panadol, Calpol for the kids. They're all household names, right? But every single one of them contains that same active ingredient. And this is exactly why just looking at the brand name can be a huge mistake. You've got to read the fine print.
Which brings us to the #1 rule, always check the active ingredients. Let's say you take a Tylenol for a headache, but then later you take a cold and flu medicine that also has acetaminophen in it. Boom, you've just accidentally double-dosed. And that is, without a doubt, the most common way people get into trouble. So, how does this little pill actually work its magic? Well, it's a bit different from other painkillers you might have. And that difference is key to why it's often considered safer for a lot of people.
Here's the simple version. For pain, it basically tells your brain and spinal cord to produce fewer of the chemicals that scream, ouch. And for a fever, well, think of it like this. It acts on your brain's internal thermostat. When you're sick, that thermostat gets cranked up way too high. Paracetamol just dials it back down to normal. Simple as that.
And here's its big advantage over drugs like ibuprofen or aspirin. It's way gentler on the stomach lining, and it doesn't mess with your blood's ability to clot. That's why it's so often the first choice for people who might have stomach ulcers or are at risk of bleeding.
Okay, now we are getting to the most important part of this whole explainer, the numbers. And these aren't just suggestions. These are the hard and fast limits that separate safe relief from a really dangerous, toxic overdose.
For a healthy adult, this is the magic number you need to remember. 4 grams. That's 4,000 milligrams in any 24-hour period. To put that in perspective, that's 8 of those extra-strength 500 milligram tablets. Go beyond that, and you are officially in the danger zone for liver damage.
Now for kids, you gotta throw the adult rules out the window. It is a completely different system. The dose is never based on their age, it is always calculated based on how much they weigh. The standard is 15 milligrams for every single kilogram of body weight, and you can give that every 4 to 6 hours. This calculation is so important, so let's just do it together real quick. Step 1, weigh your child. So let's say they're 15 kilos. You multiply 15 by 15, which gives you a 225 milligram dose. Then you look at the bottle to see how strong the syrup is, and you measure out the exact amount. Getting this right is everything.
So what happens when these rules get broken? Whether it's on purpose or, far more often, by a complete accident, this is where the world's safest painkiller shows you its dangerous side.
This quote really says it all. The problem isn't usually someone taking a whole bottle at once. It's that accidental duplication. It's taking a painkiller, then a few hours later taking a cold and flu medicine, and then maybe something for sinus pain, and not realizing they all have paracetamol in them. It just adds up so fast.
And just look at how narrow that margin of safety really is. For an adult, a single dose of 7.5 grams, that's less than double the maximum you should have in a whole day, can be toxic. And for a child, the toxic dose is also frighteningly close to the total daily limit. This is why precision is absolutely everything.
If you ever suspect an overdose, these are the red flags to watch for.
Things like repeated vomiting, really bad stomach pain, and being unusually sleepy are the early signs. That yellowing of the skin or eyes, that's jaundice, is a later and very, very serious sign of liver damage. If you see these signs, you need to get medical help immediately.
Okay, we've talked about the risks, so let's finish up with the solution. Here is your clear, simple checklist to make sure you're using this medicine safely every single time. This is your big takeaway.
So let's run through it. 1. Always respect that 4 to 6 hour gap between doses. No cheating. 2. Use a proper measuring syringe, not a random kitchen spoon. 3. This is the golden rule. Never combine 2 different medicines if they both contain paracetamol. And 4. If a fever hangs around for more than 3 days, it's time to call the doctor. You follow these rules, and you are in complete control.
So, next time you reach for that familiar box of painkillers, I wonder, will you look at it a little differently? This is such a simple, effective, and common medicine. It's an amazing tool for our health. But like any powerful tool, it absolutely demands our respect, and it demands that we pay attention to the rules.